Welcome to NTV World Insight. Around 2.3 million women were diagnosed with breast cancer in the year 2022, and nearly 670,000 lost their lives to it. Breast cancer remains the most common cancer in women in almost every country across the globe. While much rarer, it is also important to note that men can also develop breast cancer, accounting for roughly 1% of all cases worldwide. The good news is that more people are surviving breast cancer today than ever before. In countries with strong screening and early detection programs, over 90% of early-stage cases can be treated successfully. But there's still a big gap. In many lower-income regions, breast cancer is often found late, and that makes all the difference. If nothing changes, the World Health Organization has projected that by the year 2050, new breast cancer cases could rise to 3.2 million each year. That is a strong reminder of how crucial awareness, access to screening and timely treatment are, not just for women, but for everyone. We are pleased to welcome Dr. Banira Karki to today's NTV World Insight. She is the first female breast oncosurgeon in Nepal with over 10 years of experience in the field of surgery, her special focus being breast conserving and reconstructive procedures. Dr. Karki, welcome to our show.
Thank you for your invitation.
Let's start with the basic. Let's do it quick, but let's delve into what cancer is and how breast cancer is different.
If we talk about breast cancer, the cancer basically it starts from the ducts. It's basically the milk ducts. So there are these cells which the number of cells when it starts proliferating and then it grows very uncontrollably, so that now it forms a lump, and then when there is a lump it starts invading the outer tissues as well. So that is when a lump is felt in the breast. So this is how cancer is detected. The next thing is, yes, how it is different. I would say breast cancer is mostly related to the, as I said, ducts, lobules, and it is and it occupies the breast, and then slowly it also invades into the lymphatic channels, through which it may be palpable in your axillary nodes, okay, and sometimes also into the cervical nodes.
Mm-hmm. Throughout the years, in your experience, what are the different kinds of cases that you've come across? Is it different across age groups or even gender? As I earlier also mentioned that even men can have breast cancers. So what are the different cases that you have witnessed?
So there's a lot of variation in breast cancer. It's all breast cancers are not same. They are quite different, and they present in a very different way in every individual. And when we come to the age groups, I've seen as early in 15 years old young girl with breast cancer, and it was a very rapid growing, fast growing breast cancers. And we've noted that when coming to breast cancers, when it is present in young patients, it's a very progressive and aggressive type of breast cancers, which grows rapidly and it also spreads quickly. And when coming to older ages, the later age I have encountered is 85 years old women, and the type of cancers every one of us have come across in old lady is basically a very small type of lesions, and these are very slow growing type of tumors. And moreover, the most common type of cancers we come across is between now in my practice is late 30s to late 40s.
Mm-hmm. Talking about our statistics that we have, the latest that we have is of 2022, and that's by World Health Organization. 670,000 lost their lives in that year. It's a very jarring number. What has the trend been like overall?
If we talk about breast cancer cases, the number of new cases every year, it's increasing. As you also said, by 2050, there's going to be a global rise, and it was also expected that by 2040, it's going to be rise by 2.5 million new cases. So similarly, when we talk about the death rate in the developed countries have declined compared to previous. But then the death rate in a country like ours, in the underdeveloped countries, the death rates have still not fallen down. So this is the difference that we are facing. The number of new cases are increasing worldwide, but the number of death rates are still, we are still facing those kind of cases in our practice.
Mm-hmm. So 3.2 million, that is if we do not have early screenings or if we do not probably adopt a healthier lifestyle, I guess, right?
True. early detection actually helps us cure the disease. It also has a better prognosis, and we could give a very good treatment, near to curable treatment. Almost 98% of breast cancers are curable when they are diagnosed in the first stage, right? So around 90% at least we can treat completely if they come to us with the second stage breast cancers. But as the stage increases, if it's an advanced breast cancer, then the prognosis will be comparatively little worse. So early detection saves life, again I would like to say. So for that, screening is very, very important.
There's also a lot of worry, fear, skepticism as well for people to go and get themselves checked. How do we encourage people to get it done?
First thing, I would like to tell everyone that all kinds of lumps we come across in our breast is not cancerous. It's only 20 to 30% of the lumps that we have in our breast are cancerous, whereas the remaining 70 to 80% of the lumps are non-cancerous. So we need not be scared, first thing, because there are patients, they come to us, they're very anxious. I felt this and I haven't slept entire night, and they come crying, now I got the cancer. But it's not that in every individual. So yes, awareness is very important. You should be aware, and if you feel anything, then you should come timely.
With awareness, there's also a question about accessibility. How have you viewed the issue of accessibility in Nepal?
Yeah, in Nepal now things are quite available, I would say. First thing is expertise, which we lacked in our past years. Now we have breast cancer surgeons in Nepal as well, who would actually deal with only breast related diseases. So that is important. Whom do you confront to? Next thing is the type of investigations which we do it in developed countries. We do have everything available in Nepal as well. And coming to even remote areas, we could at least do the basic ultrasound, for the detection of breast cancer, even if we don't have the higher imaging techniques. So that so with that only, at least we could detect cancers.
You've had more than 10 years of experience in the field. How has our technology advanced over the course of time?
Yes, over the period of time, technology has advanced, and talking about our field, there are very few tests that are actually required in breast cancer, the entire treatment. So the basic ultrasound, we already had it, and mammography also we had it from past many years. Then third thing is for the metastatic workup, we would say, that is to see the spread of the disease to the entire body parts. We had CT scan, but now we also have PET CT scan, which is the recommended standard investigation for the metastatic workup. So we do have all the investigation facility in Nepal now.
What are some of the most common misconceptions about breast cancer? Are there misunderstandings? Are people not understanding what it actually is?
There are actually so many myths about breast cancer, I would say. Many people still up till now the gold standard investigation is mammography, right? It's a kind of an X-ray which we do to detect the breast cancers. So many people have this concept that if we do a mammography, then because of the radiations you'll get you'll get cancers, which is not so true, I would say, because the type of the amount of radiations which is given in this mammography is very less. It is very less, so you can safely do it every year. So many people, they do avoid doing mammography because of this fear. Because of the radiations, but the radiation dose is very low, so you can safely do it.
What, apart from early detection or getting yourself checked in periodic basis, can one do in order to avoid breast cancer?
So yes, in order to avoid breast cancer, first thing is every individual should have awareness. Next thing is they should know about their breast. Self-breast examination is very important. I would advise every woman to do a breast self-examination once a month. So at least this is not just that you'll be able to find a cancer, but it's just to know yourself, know your body so well, so that if there is any changes, then you will come to know. If you examine your breast every month, once a month, and if there is certain new changes that you've noticed, maybe there are certain skin changes, maybe there are certain discharges, or maybe there is disparity in your size, or there is some dimpling in the skins, very small little things. If you notice anything, then if anything is evident, then you should come up with that. So for that, I think I would suggest like everyone should do a self-breast examination.
So any changes at an alarming level warrants a checkup?
Yeah. Any age and any type of changes you note in the breast.
What cures are available to us at the moment?
Talking about breast cancer, the first most I would say is surgery. Okay, so surgery, we have options. Long time back there were no much options, so the only thing was mastectomy, that is getting your entire breast removed, and also removing all your nodes, okay, which would definitely give some form of morbidity, like people might have some kind of swellings in their arms, the post-operative complications. But now things have changed. So we have, in the surgical field, we have moved towards conserving the breast. So breast conserving surgery is what we are doing today, and also regarding the axilla, we are not doing the massive nodal dissection nowadays. We've come across to only selective nodal dissection, okay, like which we call it a sentinel lymph node biopsy in selective cases, so that we could avoid those morbidity in patients. And besides that, yes, we have all the facility of chemotherapy. All the drugs are available in Nepal as well. Following that, radiotherapy, that is you give radiations to the affected breast, to the chest wall, and to the axilla as well. So, and fourth thing is the hormonal therapy. So some people, depending upon their tumor, their cancer types, they might need hormonal therapy, so which we give it for 5 to 10 years maybe, depending on the patient.
How do you decide which treatment to give to whom? What are the stages or types that categorizes these treatments? So
see, actually for every patient we have a tumor board meeting. It's not that one individual decides the treatment for that patient. When we have all the reports, all the investigations, once the patient is diagnosed with a breast cancer, so there is a team that sits, and then we decide what would be best for this individual, and that we decide based on the size of the tumor, okay, location of the tumor, and we also decide upon the number of nodes involved or it's not involved, okay, whether there is spread to the other parts of the body. So depending on all these and the staging, which stage the patient presented to us. And another most important is the type of tumor patient has, because some types of breast cancers, they are very aggressive. Okay, they spread very quickly via blood and they go to the different parts. So those type of cancers we initially treat with chemotherapy. And sometimes patients, they present with a very large size tumor. So in those patients, we do not directly go for surgery. So those patients, we try to, stage down. If the patient is in third stage, then we try to first give the chemotherapy. Our priority would be that the tumor should not spread to other parts of the body. So we downstage the tumor. If it is in stage 3, then we try to get it to stage 2 or 1, okay, and then only we go for surgery. So by that time, the tumor will also shrink. And we also stop the process of the spread to the other parts of the body, and that's how we treat the patient. And in those patients also, yes, we can give the options of breast conserving therapy, because once the tumor has shrunk, so it's easy for us to preserve the breast.
How does this breast conserving surgery and the procedure look like?
So breast conserving surgery is like, it's basically we remove that tumor, but along with that tumor we also remove a small amount of tissue around it, okay, so that we do not touch the tumor, just the surrounding tissue. We remove the entire tumor along with the surrounding extra normal tissues, okay. So after that tissue is removed, then there is definitely a defect. So for that defect we do some oncoplasty techniques, so that we could give them a good cosmetic outcome. We do certain procedures. There are various procedures which we perform, level 1, level 2 oncoplasty, so depending on the patient's need, and then that is how we reconstruct the breast. But in some patients we cannot preserve their breast, Okay, like it's not an oncoplasty. But then those patients in whom we have to remove the entire breast, for them we need a massive reconstruction. In those patients we create a new breast. So that maybe you can put an implant, okay, or you can use the body parts from the same patient, sometimes from, you know, the tummy fat or the fat from the backside and the muscles, and then you can just, you know, put it up then and give it a shape. So that is just for the cosmesis.
Do a remarkable number of patients prefer to do that?
Very less in Nepal, very less, I would say.
What's the reason?
Because of the cost issues. Because for those reconstructions, we also take help from the plastic surgeons as well. And because of the cost issues, many of them, they avoid this type of reconstruction. But moreover, we are doing, as I said earlier, you know, the simple oncoplasty. With that, we are being able to give a good cosmesis to our patients.
There are also concerns that we have a lot of cosmetic procedures being done at this day and age. Do these procedures or the materials that are being used to enhance one's beauty, do they affect or trigger a situation like this?
No, not actually. Because when we are doing, you know, there are patients, they come with a very big sized breast. So for them, sometimes it's very difficult because of the size of the breast, they have this back problems. So they come for breast reduction, in which we do a reduction mammoplasty, which we call, in which we reduce the breast and bring it to a smaller size, so that it's very compatible for the patient. With that, we are just removing a certain glands, certain part of the tissue. So the rest of the breast tissue will be preserved. So that does not make much difference. And besides the other types of reconstruction, when we do, if in case the patient has a very smaller breast, or we are, you know, getting a part of tissue from the other side and then making a breast, that does not add to cancer.
This is for the cases where people are doing it for enhancements.
Yes, for enhancement and also for reduction.
But you're talking about enhancement by using tissue from other parts of the body. What about foreign materials that people tend to use?
Foreign materials, people are generally using silicone implants. Besides that, nowadays fat grafting is also being very commonly done. So, you know, you remove fat from your this tummy fat, mostly, sometimes from the thighs, and then you can just, you know, put it into the breast, so that you fill the breast with the fat, and then you can give it a shape.
So there's no concerns regarding?
No, there is no concerns, or there is no issues with it, like it in future it may lead to breast cancer. There is no such issues with it.
Many women, lactating mothers in fact, these days, out of lifestyle obligations, let's say, or for various reasons, are opting out of breastfeeding. Is there any correlation between breastfeeding and breast cancer?
Yes. Two things I would like to say. One about pregnancy, and also breastfeeding. I would like to add pregnancy to this as well. Because the number of kids nowadays that people are conceiving is very less. They are moving to 2 or 1 these days. So pregnancy is actually, you know, a protective for breast cancer, because that time, then that 9 months, the hormone exposure, estrogen hormone exposure, is very less in your body. So that's why the breast cancer rate decreases with the number of child you have conceived. Okay, with the increasing number of child, the rate decreases for the breast cancer. And it's similar with the breastfeeding. Again, breastfeeding is a protective mechanism. So it's protective for breast cancer and as well for cervical cancer as well. So that's why we advise to, you know, at least exclusively breastfeed for 6 months. And up to 2 months, 2 years, WHO recommends to breastfeed. And this also, it's not only beneficial for the child, but also for the mother.
What about women who don't have children?
Yes,
are they more prone to having breast cancer?
Yes, yes. Patients who are unmarried or who does not have child, who has not breastfeed, they are all compared to other population, they are comparatively at a higher risk to have a breast cancer, slightly higher, I would say.
Are there any ways to make up or compensate for it?
I would say get married on time and get your kids on time, and obviously breastfeed.
When you said get married on time, is there a number to it?
Yes, married on time, I would say, actually it's you have to, it's better always to have your first kid before the age of 31 years.
As you also mentioned that we do have expertise in our own country, but many people are also preferring to take treatments elsewhere.
Yeah.
Is there a reason behind it?
Yes, I would, to this I would say actually a long time back there were no expertise available in Nepal. So from there a trend started. People started going to India moreover for cancer treatment, because they have very good institutes and they have proper cancer centers. In Nepal we did not have that well set up cancer centers, but now we do have good cancer centers and also expertise as well. But still people, moreover I see patients, we counsel, and then some third party, they go home, discuss, and then one says, no, let's go to India, it's we have all treatments there. So that's how patients are flying to India. But then I would like to make or reassure everyone that now expertise are available and also all the technologies are available. So you can trustably get treated in Nepal as well, because it's not a matter of one day, it's a matter of a lifetime. So every time you have to fly for follow-up. Okay, so that's also financial issues will also be there regarding it. And if you are having the same level of treatment, you're getting it in your country, why do you prefer to fly outside?
Say a patient gets treated and cured, what are the chances of recurrence?
Again, it all depends on the stage of the patient, the stage of the patient presented. And also it also depends upon the type of tumor. There are certain type of tumor, like we say it triple negative breast cancers, HER2 positive breast cancers. Those type of cancers are a little aggressive and the chances of recurrence is comparatively higher in those patients. So we advise them for a very strict follow-up. But if it is a hormone positive breast cancer, then those patients, when treated in early stage, the chances of recurrence is very less. But yes, with cancers they are always possible that you might get you are always at a high risk if it is a cancer patient, especially in context to that you might get cancers on the other side of the breast, maybe 5 to 10 years down the lane. So that's why a regular follow-up is very much mandatory.
In case of men, what does breast cancer look like? Is there a specific type of region or lifestyle, age group that makes men more prone to breast cancer?
See, if you look into the ratio of male breast cancers, then it's very less. It's just about 1% of the entire breast cancers. The presentation in male breast cancers is almost similar as that of the female. They also present with a small lump, or sometimes it looks like some small skin lesions, or sometimes they also present with some watery or blood discharge from the small nipple they have. So the presentation would almost be similar. Okay, but then if I also talk about the treatment, then that would also be similar to that of the females that we offer. And regarding the age group, breast cancers in male is seen mostly after the age of 60 years, 60 to 65 years later only. It's not commonly seen in the younger age group in male.
What does life for a patient during treatment and after treatment look like?
When a patient is diagnosed with cancer and when we explain about the entire treatment course, patient is, I think, emotionally very much drained out, because it's a very long course of treatment, and next thing is they are very uncertain whether I will survive, I will not. So there is this emotional breakdown what we have seen in the patient, and moreover they are more concerned with chemotherapy. With chemotherapy, chemotherapy is it's a drug which we give to these cancer patients. So there are many side effects of chemotherapy. So there is this hair fall with it, and you feel very weak, agitated, and you don't feel like going out. You feel so little, in society. You're not being able to move out so freely, and your body is very weak, and you have that fear that you might not survive. So that is the major issues patients they have. and your appearance looks completely different. So dealing with all these things, and again fighting back with cancer, and thinking about your family and your further future. So patients are very much affected. They are psychologically also stressed out. So this is during this course of treatment, we find that like these patients, they need much of the support from the family, and obviously from the doctors as well, but moreover sometimes also from the society. There are certain social groups who help them with it. And after the course of treatment, I have seen most of the patients, they come out very strong, very brave, because they have conquered this battle, and they come out very fearless because they now have a new face. Post cancer, there is also this hair growth, and the type of hair that comes out is little thick, curly. It gives them a new face and a new look. They come out completely different, and I've seen them come out very brave, and now they are ready to start a new life, and now they have overcome their fear. So this is the difference I have noted in patients who are undergoing treatment and who have completed their treatment.
That sounds very encouraging.
Yep.
What about women who are going through menopause? Is there a certain connection with it?
Yes, the patients who are going through menopause, because there are so much of hormonal disturbances, hormone imbalance during that phase. You're not having your periods, at a regular time. So what happens sometimes? Sometimes it's 6 months, 8 months. So you are at the perimenopausal phase, towards your menopause. So those type of patients are also likely to have breast cancers. That's what we have seen. And besides, they also have so much of mood swings, irritability. So that's what has been noted in these type of patients.
Dr. Banira Karki, thank you so much for being on NTV World Insight, for all your contributions and also your insights.
Thank you so much.
And that said, it goes without saying that early detection, good lifestyle can help us deal well with breast cancer, help us avoid breast cancer, and also get timely treatment. Thank you so much for staying with us in this program. Do join us on our social media pages, YouTube, and also visit our website www.nepaltvworld.com for more information, news, and updates. That's it from me for now. Thank you for staying.